Hi, I'm Dr. Jill Vecchio. I'm a practicing radiologist specializing in breast imaging in Colorado. I got tired of the rhetoric on both sides of the aisle about the new health care law called the Patient Protection and Affordable Care Act, commonly known as Obamacare. So I decided to read the bill myself. I've read it, outlined it, researched it, and I've given many talks on it, and I'm here to talk to you about it today. We're going to go through a series of YouTube videos where we're going to cover lots of different parts of this law. First of all, this is what we're going to cover in this series. What are the problems with health care and why is it so expensive? Will everyone be insured and how? What happens to Medicare? How much will PPACA cost? How do the state health care exchanges really work? What does this mean to employers? What does this mean to my doctor and to me as a patient? What are the lawsuits about? And what's happening in the courts? What are some of the other ideas for healthcare reform? Let's talk about what the problems are with healthcare right now. First of all, we have a problem with access. There are a lot of people that are uninsured. We're going to address that. There's also a doctor shortage. 35,000 doctors every year are leaving the healthcare profession, and only 25,000 are graduating from medical school every year. Let's talk about the costs of unreimbursed care. Millions of dollars every year are spent by hospitals and individual physicians providing care that they don't get paid for. That is a problem that we need to address. Healthcare and health insurance is expensive. It's too expensive. I agree with you. I am not here to protect the insurance companies or the pharmaceutical companies or anybody else. There are a lot of areas for improvement. Let's talk about that. Another big problem right now is utilization. We're using too much health care. Do I think it should be rationed? No, but we are overutilizing. So we all agree that health care reform is needed, doctors and patients alike. But is this the right reform? Is Obamacare the right reform? Will everyone have insurance under PPACA? Who are the uninsured? If you look at this pie chart, you'll see in the bottom three sections that 25 million, if you count 52 million as the amount of uninsured patients, it varies between 40 and 55 million. So if you say there are 47 million uninsured, let's just use that number. If you look at the bottom three pie pieces, you'll see that 25 million of the uninsured, this was before PPACA was passed, 25 million consisted of people who either made enough money that they could afford to pay for health insurance, or people who qualified for government programs, or people who qualified for employer programs, health insurance, and they chose not to get it. They've made a choice. That leaves 22 million Americans that do not have access to adequate health insurance. Those are the people we want to address. Now, according to PPACA, according to the Congressional Budget Office, even if everything worked perfectly with this new law, 22 million people would still not have access to health insurance. They would not be covered. We, as tax-paying Americans, would still subsidize their care. So the number of uninsured who really can't afford coverage is no different. 47% of the newly insured people would be put into government programs, Medicare, Medicaid, and SHIP. SHIP is a child health program that's government sponsored. So 47% of the people who would have new health insurance would go into government programs that are paid for by taxpayers, either on the state or federal level, but it's still paid for by us, the taxpayers. Now let's see. Let's talk about the individual mandate that they've talked about. So individual mandate means that each person is required to have health insurance or you pay a penalty. Sometimes they're trying to call it a tax, penalty, tax, whatever. It's the same thing. So starting in 2014, $95 will be your penalty if you choose not to have health insurance. That'll go up to $695 by 2016 or 2.5% of your income, whichever is higher. But there are certain exceptions. So you can see the list here of different individuals and groups that will be exempted from paying the penalty for this health insurance. So let's see. So they won't be penalized for not having health insurance. So what are the chances are that they're actually going to get it? We will still be subsidizing these individuals. Massachusetts, commonly called Romney Care, is actually called Commonwealth Care. But in Massachusetts, they have an individual mandate, and they've had one for several years. So in Massachusetts, what they're finding is that individuals choose to pay the penalty rather than getting health insurance. Under their plan, as under PPACA, they can choose to get health insurance at any time with no additional penalty. They call the insurance company and get a policy. So they wait until they get sick, they call and get insurance, the insurance companies issue them a policy. When they're well again, they drop the policy, and then they go back to paying the penalty because it's a lot cheaper than paying the premiums, as we'll see later. We'll go into the costs of the premiums. So the insurance company is only covering people that are already sick or have very high risk and are paying some insurance premiums. The premiums skyrocket. So the 4 largest insurance companies left in Massachusetts in 2010 all declared over $1 million in losses. This isn't a sustainable system. Also in Massachusetts, in order to insure additional people, they expanded their Medicare and Medicaid programs. That's the same plan that's going to be happening under the PPACA law. The reimbursement to providers, hospitals, physicians, non-physician healthcare providers, includes rehabilitation, physical therapists, and so forth. The reimbursement often doesn't cover our costs. That's not sustainable either. So providers have stopped participating in Medicare and Medicaid in Massachusetts. The result of that is that patients who, even though these patients may have an insurance card, they can't find a provider. The average wait time now in Massachusetts to see a primary care physician is 48 days. Massachusetts has the most physicians of any state in the country and the longest wait times to see a physician. Now you can see here, I'm going to let you look at some of these numbers yourself. But this is a survey by the United Nations International Health Organization, and I've kind of highlighted some of the more interesting parts of this to show you that there are huge differences in the quality of care, the immediacy of care in the United States versus 2 other countries that are commonly referred to in justification for PPACA, the United Kingdom and Canada. So let's look at one of these. The percentage of patients diagnosed with diabetes who receive care within 6 months of diagnosis. People can die within 6 months of their diagnosis of diabetes if they're not treated. United States, 93%. That's a pretty good number. United Kingdom, 15%. This is what nationalized health care can do to us. So we've talked about who's going to be covered. There are a lot of people that won't be covered. In fact, the number of people without insurance may increase significantly by 70 to 80 million people if employers choose to pay a penalty rather than to pay the high premium costs. We've found out that almost half of the newly insured people are going to be on government programs that will be subsidized by we the taxpayers. Now the next thing we're going to cover is costs, and we're going to do that in 2 separate segments because there's a lot of information there to cover. So the next segment will be on costs. See you then.